Now, 2021 should be a year of increased focus and action on climate change, with a big international summit due this time next year. There is a growing understanding of the impact that climate change is having on human health. But health systems and health professionals are arguably not yet prominent enough as advocates for what needs to be done. The WISH Climate Change and Health Forum discussion is going to take a fresh look at some of the key issues.
Hello, everyone, and welcome to this WISH Forum discussion on climate change and health. My name is Stephen Sacker, and it is a real pleasure for me to host what I think is going to be a fascinating hour or so of discussion. As Michelle Hussein said, a forum discussion lies ahead of us where we are going to look at climate change in the context of global health challenge. It fits so neatly into the overarching WISH theme this year, which is all about one world and our health. And if we think about the global challenges that we face when it comes to future health problems and challenges, then surely nothing can be more profound, more disturbing in many ways than the impacts of climate change. Let me begin by saying I wish I could be in Doha in person, as I've been for previous WISH conferences. It's a great shame we can't all gather together, but I know lots of you are watching right around the world. Welcome to all of you. A very special thank you from me to everybody in the WISH team, and of course to the Qatar Foundation and the leadership of Her Highness Sheikha Moza, who has again driven forward this conference. I know that everybody involved is so grateful for her leadership. I'm going to introduce you to our panel. We are then going to hear the presentation of the forum report coming from Dr. David Nabarro, whom we've already heard from today. David Nabarro, who is such a key player right now in the battle against COVID-19. In his role as a special envoy at the World Health Organization. But he has an incredible background in all sorts of different public health challenges. So I'm going to introduce David's forum report in just a moment, but let us go through the entire panel. I'll introduce you to everybody. And panelists, when you hear me read out your name, just give a little wave to the camera wherever you are around the world so that people know exactly who is who. So let's start with David himself. You've heard from him already today. He's co-director of the Institute of Global Health Innovation at Imperial College in London. And thank you for the cheery wave, David. We're going to hear your presentation in just a moment. Cristiana Figueres is a familiar figure to many of you. She was the driving force in many ways behind that incredible political and diplomatic achievement of getting more than 190 countries together to agree on the Paris Agreement on climate change. And the commitment to doing what it takes to decarbonize our world to ensure that global temperatures do not rise above 2 degrees centigrade. Indeed, the aim is to get them to rise substantially less than that. Whether we achieve it is something which may crop up in this discussion. But Christiana, thank you for joining us and welcome to you. We have Elizabeth Iro with us. Now, Elizabeth has an extraordinary story to tell. She is from the Cook Islands. She was Secretary of Health in the Cook Islands, a small group of islands which, of course, is deeply vulnerable to rising sea levels as a result of climate change, and we shall talk about that. But right now, Elizabeth is Chief Nursing Officer at the World Health Organization and brings a vast amount of experience in the field of nursing to our discussion today. I also want to welcome Paul Farmer. Paul is the co-founder, chief strategist of Partners in Health. He is a highly experienced physician and indeed anthropologist as well, so brings all sorts of different life experience and academic experience to this discussion. I want to welcome Ali Al-Dabah, who is Deputy Director General of the Qatar Fund for Development. And it's great to see you here, Ali. I wish we were all with you in Doha, but sadly that cannot be. But thank you for joining our discussion. And finally, also with a Qatar perspective, please welcome Roberto Bertolini. Now, he is a senior advisor to Qatar's health ministry. He has a whole lot of experience in international public health. He served as the WHO chief scientist in Europe for some years. So we've got a fantastic panel full of insight and experience, and I'm looking forward to quizzing them, particularly on this question of how we ought to view climate change in terms of challenge to public health over the next hour. But what we're going to do first, and I should say, by the way, before we hear from David and his introduction, I should say this discussion, it's guided by me, but it is going to be very interactive. I'm standing by with my smartphone, and I'm going to be fed questions coming from you from all over the world. So do feel free to participate on the Wish platform. We want to get your insights, experience, and questions woven into our discussion over the next hour. But let us begin by hearing the thoughts of David Nabarro, who chaired the forum panel, the experts who were put together to consider this whole question of climate change and health. So let's hear David's initial thoughts now.
Good day, it's David Nabarro here, and I'm delighted to talk to you about our report, Health in the Climate Crisis. It's a guide for health leaders. I'm personally working at the moment on COVID, and I think that what I've learned through COVID is that when we do come together, we can be effective on dealing with really massive issues. And the climate crisis is a big issue. So what we've done is we've written a report that addresses the authentic and authoritative roles that health professionals can have with the public and also with policymakers. We feel that the health lens focuses attention on the issues. It demonstrates what practical action is possible. We start by looking at how health is affected by climate change. We look at the direct impact of heat on people's health, on food and water insecurity. We look at storms and floods and how they affect health. We look at how climate change is affecting communicable diseases, increasing air pollution and changing the levels of allergens in the air. We look at the social and economic instability that happens as a result of climate change. And what we do then is to dissect out the different outcomes that come from these different threats and show that these are really serious. And over the top of all this, we look at how mental ill health is exacerbated by climate change. We go on to look at how health systems are affected by so many aspects of changing climate. We dissect them out into the disease burden, the way in which climate change affects facilities, and we also talk about climate change in the economy. And then we show how this affects the quality and impact of health services, the degree of coverage of populations, and the cost of providing health care. This takes us then into analysing the co-benefits of health and climate action. Well, first of all, we show that lives and well-being, as well as the efforts to sustain the planet, can both benefit as a result of working on some very specific areas, on clean air, on efficient energy, on transport, on diet, on safe births, and on green space. And by demonstrating the synergies, we, I think, help all health leaders to be able to move forward in a constructive way. And that brings us to the climax of our report. This is an index card on what health leaders must do. There are 10 points in this index card, and you know we'd really like you to cut it out and keep it, because we think these can be helpful. Here they are. The first 5 are about you. Be the change. Build resilience in societies to the health impacts of climate change. Go for green facilities and try to make sure that they're sustainable. Reduce waste in your healthcare activity. Steer your suppliers so that they supply in ways that are sustainable. And track the footprint of your own operations and those with whom you're linked to make sure that the climate impact is as low as possible. These are things that you as a health professional can do. And then you've got something that can go even further. You can actually lead the change, mobilize your workforce, highlight ways in which everybody can adapt to climate impact, invest for environmental well-being, valuing the environment at all times, create coalitions of action on climate and health, and make sure the air is clean, because the impact of clean air is so huge. You, health leaders, have so much to offer. You can bring ambition into the debate. You can be audacious. You are seen as authentic, and you are often called to account. And that's why we've done this report, and that's why we hope that you can become actors for health in the climate crisis. Thank you for listening.
A really positive opening statement there from David Nabarro. And David, I thank you very much for putting that together. And you presented us there with a checklist of things that you think that health leaders can do to make a real difference, and, to use one of your quotes, be the change. But I want to begin the discussion, Christina, with you, because it strikes me that we all know you from your work trying to get this Paris Agreement together, working so hard with senior politicians, diplomats, and with corporate leaders as well. They're the kind of people we associate with driving change in this field of climate debate. How important do you think that health leaders can be? How significant can their role be?
Well, thank you. Thank you very much. Good morning, good afternoon, good evening to everyone. And I must say thank you very much to Dr. David Nabarro for that report, and to everyone else who collaborated. David is one of my totally favorite people, and I had never had the pleasure of seeing David twice on the screen at the same time. So that actually is quite a treat, because I usually have him only once on my screen. So to have 2 Davids is quite delightful. But to your question, honestly, it is surprising that we don't have more health leadership on climate change, because I have been saying for a long time, and there is mounting realization about this, that the Paris Agreement may be thought of by some people as an environmental agreement. Actually, it is a health agreement. It is an agreement for the health of humans and the health of the planet, because we have to understand that those 2 health universes are one and the same. They're not separate. It is only on a healthy planet that we can aspire to have a healthy humankind living on that healthy planet. And there has never been a more compelling argument for this than during the pandemic that we have been having, where it has been very clear that because we have been moving into areas and deforesting, we have actually created these zoonotic diseases, and we will be creating many more zoonotic diseases. And that's just the deforestation part of climate change. But in addition to that, the 7 million people that are dying prematurely because of air pollution are dying substantially because of the burning of fossil fuels. The same fossil fuels that are polluting our lungs and are polluting the lungs of the planet. So we have to understand that this is one and the same issue, one and the same challenge. And that is why in May of this year, organizations that represent 40 million health professionals, including the World Medical Association, the International Council of Nurses, the World Federation of Public Health Associations, and the World Organization of Family Doctors, and the American Public Health Association, 40 million health professionals, wrote to the G20 governments requesting that there be a healthy recovery from COVID-19. We have to be able to bring the recovery packages that are being capitalized and are being invested. They have to be packages that are, yes, absolutely producing jobs, but they have to produce those jobs in the areas that give us clean planet for clean society. Now, finally, let me just say, in this COVID pandemic, we have seen and have read so often that the health professionals have been on the front line of the pandemic. That is true, and we're all very, very grateful to those who continue to be on the front line of the pandemic. But if you look at this just from a little bit more perspective, the fact is that health professionals are both on the front line of the pandemic, trying to do the curative, but they're also at the back, picking up the pieces and frankly cleaning up the mess of bad decisions that were made further up the pipe. So that is where this report is absolutely critical, because what the report calls for is for health professionals to move forward, to be in the front line, not just of curing the effects, but avoiding. We all know that avoiding is better than curing. Preventative decision-making is what we need, and there is no profession that knows more about the much higher value of preventative policy than the health professionals. So we are delighted with the report, and we hope that it's going to help to build a very strong platform under health professionals to not just pick up the pieces from other policy decisions in other sectors, but actually to be leaders and influencers in deciding on policy on climate change.
Great. Thanks so much for that, Christina. I want to cross now straight to Elizabeth, because Christina gave us a great overview there of why health leadership matters so much, and the very widespread implications for public health across the world of climate change. I now want to drill a bit deeper into a very specific situation, which is yours. You are, as I said, a native of the Cook Islands. I believe I'm right in saying you served for some years as Secretary of Health in the Cook Islands. So I want you to bring your experience of a small, and it has to be said, vulnerable community living with the long-term reality that is climate change and indeed rising sea level. Just tell me, Elizabeth, how, in specific terms, you see the direct connection between climate change and public health.
Thank you very much, Stephen, and thank you, David and Christiana, for those messages you've just highlighted. I think for me, coming from the Pacific region, I'm very grateful that we actually have a Pacific Islands political leaders that meet quite regularly, and also a Pacific health ministers that meet on a biennial basis to discuss health issues within the Pacific. And I have to say that last year, the 50th meeting of Pacific leaders in Tuvalu reaffirmed a climate change as the single greatest threat to the livelihoods, security, and the well-being of the people of the Pacific. Now, as I said, small island developing states are among the most vulnerable to climate change. Of course, all populations will be affected by climate change, but some are more vulnerable than others. And climate change really, for me, I found disproportionately affects the poorest, the most marginalized, the more vulnerable, women, children, and the elderly, and especially those living in these small island development states, not just in my country, but all these small island development states, and who are really at the front line of the climate change impacts and who are significantly exposed to the natural disasters. We have seen depopulation of some of these remote islands where the elderly and the young children remain on these islands while the parents and the adults migrate to urban cities for jobs. So further compromising the situation on these remote islands. These countries face a range of acute long-term risks, including extreme weather events such as floods, droughts, and cyclones, and increased average temperatures and rising sea levels, as you said. And many of these countries already have a high burden of climate-sensitive diseases such as dengue fever, Zika, malaria, that are made worse by climate change. With the increasing temperature potentially leading to faster mosquito breeding and viral replications, and the rainfall leading to wide availability of mosquito breeding habitats and breeding places. And this can become quite a challenge for public health personnel to ensure that this is not, the situation is not further aggravated. So there are some, in some countries, in my country specifically, there's some very, I think, useful and valuable public health measures where the whole island is actually surveyed for mosquito breeding places and therefore eliminate those. And this happens on very regular intervals during the year. So as we know, vector-borne diseases account for more than 17% of infectious diseases, causing more than 70,000 deaths annually. We have seen the rising sea level and the increasing extreme weather, such as cyclones and hurricanes, destroy our homes, our medical facilities, and other essential services. And the people have been forced to move, either to relocate to another island or relocate temporarily from the situation that's been impacted more heavily. In Tonga, we have seen that they used to play rugby that is now in seawater, and the people are planting mangroves to slow the erosion. So when people are forced to move to, because of this, we see the increased health effects of mental disorders and also to communicable diseases. Now, our islands are already with an increasing NCD non-communicable disease burden. So existing communicable diseases burden also coupled with the slow economic growth, sustainable health financing is not assured in these countries. And this is a real concern. And I think for me, strengthening the health systems and health workforce will be critical to the delivery of essential health services in our countries, and the refocus on primary healthcare models of care will be necessary. And I think in this instance, nurses and midwives are going to be, well, usually, and in some places, the only health personnel in these remote areas play critical roles to, preparedness and prevention and health promotion for public health interventions. They are the most trusted profession, And in this International Year of the Nurse and the Midwife, I like to say the opportunity to then amplify the critical role of nurses and midwives, and how they play in a multidisciplinary team to address climate change impacting small island development states is going to be very, very critical. I think if I can have time.
Elizabeth, I want to thank you.
Okay.
Yeah, no, Elizabeth, I want to thank you so much for that testimony, because it's so important to hear in real and graphic terms what is happening to your community in terms of all of those physical changes, whether it be the increased danger of malaria and communicable diseases because of climate change, whether it be the rising sea level and the fact that people are already having to move. So many different ways in which this plays out. Fierce storms, more unpredictable weather events. These things really matter, and they're visible. But I actually want to turn now, if I may, to Paul Farmer and discuss something that Elizabeth began to touch on, which is more invisible. That is the mental health aspects of what climate change is doing and how we should understand it as a health challenge. So, Paul, explain to me how you see mental health fitting into this debate.
Well, thank you very much, and thank you for having me. Before I do turn to that, I just want to compliment David and others who've worked on this report. You know, I do think, back to Christiana's point, I think there is a complexity to our understandings of how climate change affects health. A complexity that does not undermine the validity of all those causal claims, but I do think, and this is related to mental health, that nurses, physicians, and other frontline workers often feel overwhelmed with an immediate task at hand. And David and I have worked in the midst of some very frightening epidemics, including cholera in the Americas and Ebola in West Africa. And you're in the middle of all this, and yet thanks to good analysis and cogent ways of seeing the world, you know that climate change is deeply connected to what it is you're seeing. I know that we felt that way, for example, in West Africa, that this was the result of a disrupted ecosystem, which liberated a pathogen not as familiar to the human host. We thought about this in Haiti during the cholera epidemic, and I could go on and on. And so I do want to underline the importance of this syncretic analysis and thank David for reminding us that healthcare professionals have a role to play, as Christiana said as well, and as she has said many times. And we need to step up and serve in that role or lose some of the symbolic capital, David, that you mentioned. Now, to the mental health question, I would just say a lot of us believe this slogan that there is no health without mental health. And so even though I'm an infectious disease physician and focused on responding to epidemic disease, one of the things that I see in every epidemic, obviously you're going to see fear, right? And anxiety, but sometimes hysteria, sometimes, and very often a deep mistrust. Now, in every instance, from place to place and time to time, the depth of the mistrust has been built over years and decades. These things are in the making. So what can be done in the middle of a crisis like this to increase levels of trust? And as you can see right now, and this is on David's plate as well, in the middle of a novel coronavirus pandemic that's affected all of us, when new tools do come along, whether they're diagnostics or preventives like vaccines, you have to have strong community trust to move forward these interventions into society to make them have their impact. And again, the relationship of this to mental health is always central. And if I had a wish to make, I would wish that we could stop putting mental health at the very bottom of the list of all of our health interventions with massive underinvestment and start investing in stronger communities. And community health workers have a role too, just as nurses, social workers, and psychiatrists. So I think these are bound up together. And I want to thank you again, David, for bringing us together, but also bringing these diverse strands of analysis together.
Thank you very much, Paul. The experience there of an epidemiologist and an anthropologist, and we've got so much wonderful insight on this panel. I do want to remind you all that you can ask a question to any of our panelists on any of the related topics around this broad theme of climate change and health. Just use the Wish platform. I've got my smartphone here and I'm going to see all the questions. So please don't hesitate. This is an opportunity to tap into the knowledge and experience that we do have on this panel. I now want to move away, or at least in a somewhat different direction, to talk to somebody who is responsible for investing in different projects which are related to this topic right around the world. So Ali Al-Dabakh, we're delighted that you could join us. You're Deputy Director General of the Qatar Fund for Development, and of course that is a not inconsiderably powerful amount of investment money that you can put into projects and initiatives right around the world. I just want to get your insight into how you can use your fund to tackle some of the issues that have already been raised today. That is, thinking about the connection, long-term and immediate connection between climate change and public health, and the degree to which that is now front and center of your thinking when it comes to investment decisions.
Thank you. Thanks, Stephen, and distinguished panelists. It is indeed our honor to be part of the panel, to be part of this year's edition of WISH. We're looking forward to seeing all of you on the next season in person here in Doha, inshallah. With the world's attention on the health system, like ever before, this is discussion on the climate change and health comes at particularly critical time. The COVID-19 has given a foretaste of the shock and that climate crisis could cause. It goes without saying, the climate change has serious consequences which can already be seen, impacting the livelihoods, health, food security, water availability, and vector-borne diseases, threatening to underline years of progress in public health. Climate change is therefore likely to mean increased humanitarian load. Additionally, its impact on one humanitarian area will often have burning on others. And to make matters worse, its humanitarian consequences are expected to become more severe for the most vulnerable groups. Hence, there are key commonalities between climate change and COVID-19 that can help inform our decisions and development agencies addressing the global challenges. Firstly, COVID-19 reminds us of the cost of global shocks on economies and societies across the globe, and hence the urgent need for accelerated action in response to the climate change. We live in a highly interconnected world that impact and implication of one challenge can escalate across many different sectors and countries. Similar to public health, climate change too is a global public good with benefits or costs that extend to all countries, people, and generations. This reasoning continues to shape our approach at Qatar Fund for Development when addressing climate change, one that builds on a strong multilateral response. We are continuously exploring innovative climate financing mechanisms and partnerships that support developing countries' transition to low emissions and climate resilient development. Secondly, the effects of the climate change will almost certainly be harsher than the ones of COVID-19, cross-cutting all SDGs, and will be the worst for the most vulnerable groups. It has been clearly outlined by the United Nations that a solution to the climate crisis that does not benefit everybody will lead to the survival of the richest. The challenges posed by climate change are especially pressing for least developed countries and small island developing states, threatening to undo decades of their progress toward the achievement of SDG 2030. And with only 10 years ahead of us to deliver the commitment to achieve sustainable development goals and promise to leave no one behind. We need to ensure the need support is provided to these countries. With that in mind, His Highness Sheikh Tamim bin Hamad Al Thani, the Emir of the State of Qatar, pledged in 2019 on the side of the Climate Summit to provide $100 million for the climate change adaptation and mitigation, with a special focus on addressing the devastating impact on the climate change on all LDCs and SIDs. Furthermore, having affected almost the humanity, COVID-19 has exposed the vulnerability of our health system and the fragility of our economies, and highlighted the importance of building stronger and more resilient health system and the need of the better disaster preparation. Increasing the resilience need to be one of the main guiding principles when rebuilding our societies after such a crisis. We need to ensure we are better prepared to resist future shocks and crises, and particularly this imminent threat to humanity, climate change. Hence, for us as a development agency, we are focusing on the need to respond on the humanitarian crisis through emergency relief to keep people alive. We are also focusing our response to economic, natural, and environmental shocks should focus on long-term recovery plans, resilience building through investment and risk management, preparedness and mitigation to build the capacity of communities to adapt on the rapid changes to the climate conditions in the way that they can absorb and quickly bounce back from such shocks, such as storms and drought when they do hit. Similarly to our response to COVID-19, our response to the climate change-related challenges is built on recovery and investment in climate adaptation. For instance, our support capitalizes on the untapped opportunities for transitioning into a greener economy and green jobs. This is in addition to our contribution to the Global Fund achieve the goal of ending the malaria pandemic by 2030. Through building community health facilities that provide malaria prevention and treatment programs, mental health, childhood vaccines, and basic health care, resulting in overall health outcomes that are stronger and more cost-effective and efficient. We need to take stock on the lessons learned from COVID-19 to shape the way we support countries most affected by climate change. Strong collaboration and solidarity is a key to ensure that those most vulnerable to the climate change are able to cope without assistance to prepare and respond. Thank you.
Ali Al-Daba, thank you very much indeed. Ali made several references there to COVID and a comparison in a way between the way the world is responding to the urgency of the COVID challenge and the different kind of urgency that we see and identify in the climate change challenge. I want to stay in Qatar now, but perhaps think in slightly different terms. I'm thinking now of Qatar itself, which of course is a nation and an economy, frankly, built on the riches that come with fossil fuels. It's also a nation which is obviously located in one of the hottest, driest parts of our planet. It is also a nation which has to think long-term about the implications of the potential of rising sea levels. So all sorts of different ways in which Qatar itself has to ponder what its future will be when climate change is so pressing a problem for the entire planet. It's a way of introducing Roberto Bertolini, who is now a senior advisor to the Qatar Health Ministry, having, as I said earlier, served as the WHO chief scientist in Europe for a long time. Roberto, now that your focus is Qatar, how do you concentrate on trying to build resiliency and a long-term sustainable strategy inside Qatar, inside Qatar's health system in particular?
Thank you, Stephen. This is a very challenging question, as you can imagine. Well, let me tell you first that I'm very pleased to be here today, also because after many years in which we have been talking, and David knows very well, I mean, about climate change and health and so forth, we start seeing now systematically this issue addressed within the health sector, which is something new and very important, because in the past, I remember the participation of 2000 UNFCCC conferences years ago, the health representatives were just children of a lesser god, in a sense. I mean, this type of presence was not so much considered. But having said that, I think you mentioned some of the very most important challenges that the countries in the Gulf are actually facing. Climate change is going to be affecting temperature. We are going to expect extreme heat, further drought, and the risk of flooding for increased episodes of intense rain in a short time. Air pollution will actually be an important issue with the interaction between temperature and the existing emissions. And all of these in a framework within which some research in the past have questioned the possibility that this part of the world will actually be adapted to human beings around the end of the 21st century. So this is a very, very big challenge. And of course, I mean, everything depends, many things depends very much by the mitigation efforts which will be made at the global level. But there is a lot to do in manage the unavoidable, which is the consequence of climate change that will happen anyway in this part of the world. And I think here we have to realize that one of the issues that was mentioned in the document that David has introduced earlier, the document on climate change, is the issue number 9, is quite an important one when it's talked about addressing cross-sector collaboration. I think that all these challenges that we mentioned actually require an intersectoral collaboration. And but starting with the health sector, I think we need also here, and once again, learning from the COVID experience, strengthen the system for emergency preparedness and early warning. This is a very important part, particularly for the extreme heat. But also we need to make sure that the system, the health system, is equipped in a proper way to respond to these different type of challenges. In the document, there was also another analogy, which I like very much. I mean, the climate change is like a chronic disease. You don't see it, but eventually, it explodes with all the consequences. And since we know that this is going to happen, we need to be very well prepared. And the COVID experience in this respect has learned us how to make an effective use of scenarios for planning health services, how to integrate response across different sectors of the health system, from the primary health care to the tertiary care. So this type of lessons we have learned will be very useful when we will supporting and strengthening the system to respond to the challenge of climate change. I mentioned the other sectors. This is a very important part, I believe, in all the climate agenda, but particularly also in the health impacts agenda. Here, we have a great opportunity in Qatar because there is a massive investment program to redesign the urban landscape here. And this is an opportunity that should not be missed. And I would say that some steps which have been taken are going in the right direction. For instance, I mean, there is a lot of efforts to build bike lanes, and we need to go for a sustainable transport policy, bike lanes with shade. There are also some rebuilding of areas of the city in which, I mean, the buildings are made in such a way to allow for a better indoor air quality, for using traditional architecture together with new materials, the orientation of the building being done in such a way that the wind favors some cooling during the day when the heat is higher. So, and also the building up of several green spaces which are being built around the city just to improve the possibility for people to enjoy. And again, mental health aspects will be also addressed in this way. There is also something to be done in terms of organization of the society in order to meet the challenges. And here, once again, the COVID is giving a lesson. We have to probably to change the timing of the work when the heat will be too intense, and be able to leave the hotter times of the day in which people will not be working outdoors, for instance, And the smart working, which has been very much applied during the COVID pandemic, might be interesting and also useful also in this respect for those professions where this can actually be implemented. So in summary, Stephen, and I think a number of actions can be undertaken to enhance resilience to the health impacts of climate change, but this implies and requires innovation, building of coalitions, innovative thinking, and more than everything else, I would say, something which I faced in my experience throughout the years, the importance of coherence of policies. We need to have coherent policies across the different sectors because this is a very fundamental issue to allow with commitment and determination to address this challenge.
Okay, Roberto, thank you very much indeed. A very strong final thought there from Roberto about the need for cross-sector coordination and collaboration, and I guess that would also go for cross-national collaboration, not something that's always easy to achieve, as we've seen during the COVID crisis. Everybody around the world, I do want you to remember that now is your opportunity to put questions to our panel, because having led the debate myself for some time, I'm now going to officially declare that we are going to swiftly move to this phase of the debate where your questions are put to our panelists. So please do come up with your own questions and thoughts right now. And David, now that I'm sort of the conduit for thoughts and questions coming from people right around the world who are part of the WISH family, let me come back to you straight away, because we've got a big thought here, and it relates to a lot of what we've already been discussing. It's a question which says, how do we balance the need to reduce each country's emissions, carbon emissions, greenhouse gas emissions, in a way that is going to allow for future development and investment in the healthcare sector? And I'm also mindful that so much of the healthcare infrastructure in so many countries was constructed quite a long time ago and doesn't necessarily represent the sort of the most smart development in terms of reducing emissions and being sustainable. And that's something surely that has to be factored into this question of how to use buildings and infrastructure in the future in the healthcare sector. So the question really is, how do you balance out the need to improve healthcare, to build more infrastructure, and at the same time reduce emissions? What are your thoughts on that?
Thank you, Stephen. First of all, just really lovely to have this panel here and to hear the great comments from everybody. Thank you all. Also, I'd really like to acknowledge the Qatar Foundation, the WISH team, and everybody who helped put together our report, which is quite short and it's an easy read. And that brings me, Stephen, to the real point you're making. And I just want to say something which I hope will appear to be pretty straightforward, but it may sound surprising. If you want to go green and to be climate compatible in your development strategy, that does not mean that you have to have any reduction in economic growth or any delay in achieving equity. We have so much evidence now that says you can be green and you can be prosperous. And that then brings me to the key thing that every health actor must do, which is to work for sustainability in health systems for exactly the reason you just said. And secondly, to be stepping up and leading for sustainability and climate compatibility in every activity. Go green, value nature, and most of all, reduce your emissions while improving adaptation, and we can pull through this. But if we don't do it, we're going to have a really difficult time in the coming decades.
Thank you very much, David. Talking of difficult times, we already see around the world climate change impacts in terms of some communities that are finding life so difficult in changed climate circumstances that they are, in some cases, being forced to move. Elizabeth referred to that earlier in terms of some experiences on the Pacific Islands, but it's seen in parts of sub-Saharan Africa as well and other parts of the world. So let me ask this question, and perhaps, Paul, you can deal with this one first, if you wouldn't mind. The question is, what challenges will climate migration, perhaps significant numbers of refugees coming from extreme climate events, or perhaps longer term issues like rising sea levels, what will climate migration pose in terms of challenges for public health authorities? And is it possible to build capacity before some of these events happen to ensure that we are properly prepared? I think, Paul, if you can hear me, Paul, if you can hear me, I think your mute button is on. Could you possibly? There you go.
I was being very obedient. I think some of the accompanying the side effects of climate migration have been noted in with mental health and pandemic disease, for that matter, at the top. I would like to answer the question, though, Stephen, in an enthusiastic and optimistic way. And even in the setting of great tragedy, such as the storms that hit Haiti in 2008 and were followed by the earthquake in 2010, and then the massive cholera epidemic that David mentioned, in the middle of all that, after Haiti's clinical teaching infrastructure was destroyed, Partners in Health and its Haitian branch rebuilt a hospital in the middle of this. As refugees were coming out, internal refugees were coming into central Haiti outside of the earthquake zone, and it made it, rebuilt it to make it completely, or to make it solar powered. I mean, this was, again, trying to seize the moment. Can we prevent some of these things from happening, to your point? And we knew that our carbon footprint was through the roof. We were running a dozen hospitals, public hospitals in central Haiti, and so we rebuilt them. And we were doing that already. So I'm just saying this was part of an exercise that a fairly small NGO charity, Partners in Health, took on in order to participate more fully in the effort to go green. Was to do that across the world, everywhere we had a clinical facility. So I guess what I'm saying, Stephen, is I'm sure we can do more. And some of this has to do with building back the space better and safer and greener, as has been mentioned by David and Mr. Bertolini as well.
Paul, I'm mindful, Paul, of your long experience in global public health, and I believe I'm right in saying you hold the chair of global public health at Harvard Medical School. So you're very plugged into the interface between sort of what we call health leaders and political leaders. Do you think politicians around the world are sufficiently aware of the degree to which health has to be at the center of debates about how to best build societies capable of dealing with climate change?
Well, I mean, you asked me at a difficult time, since I'm an American, and our government has pulled out of the Paris Accord. So I'm a little bit embarrassed by that, and we'll say the answer to your question must then be no. They are not sufficiently aware. The same can be said, however, of the medical profession. And by medical, I mean nursing, medical, all of us together. I think Elizabeth will agree that inside our professions, we have a long way to go to educate each other, to learn more. We're just starting to include these matters in our medical textbooks. I was just allowed to help take part in drafting a chapter for a famous global and American textbook in which these matters are really only just now being addressed. So I think the politicians are not sufficiently aware, and the medical professions, broadly conceived, are not sufficiently aware. And as David said, we have a responsibility and also a symbolic capital that will allow us to help get these messages out to our patients, to our students, and to our broader community. We have a lot to do.
Yes, important thought. Thank you, Paul. Roberto, I want to bring you in on this one. The question is about, essentially it's about inequality and how we wrestle with the reality of very deep global inequalities, because it goes like this. In low income countries in particular, rarely do they have resources that are focused on preventive actions when it comes to the implications of climate change. Resources are usually necessarily directed to the curative services. So how do we all, in a sort of international collaboration, work much harder to build in preventive capacity to the poorest countries?
Well, Stephen, I mean, this is probably one of the biggest challenges that we are facing, because, I remember when some years ago, when trying to picture the impact of climate change and the, let's say, the countries or the areas where the problem was originated from, we had this strange map in which you have this big, countries like the US or China, and that is small, very small Africa, very small Southeast Asia, very tiny contribution to the actual, cause of the problem. But this is reality, this is where we are. So I think that once again, this is an issue of global solidarity, and we need to understand that either we all solve these problems or no one will solve this problem. Climate change is a global issue. So we can, yes, address something at the national level in terms of adaptation. We can decrease the impact, yes. But if we don't act at the international and global level in a consistent, systematic, and committed way to address the issue, and we achieve these goals that the conference in Paris has set, and also other agendas have also set, we are not going to be out of this challenge. So this requires a intervention and commitment from the richest countries towards the poorest countries, to export technologies, to improve their waste management. What is happening now is not exactly the opposite, but it's not too close to this. If you think about the international waste traveling, the fact that some countries are inundated by waste coming from the richer country, or other type of phenomena like this, I think this has to be understood, and it requires a very important change in the international policy. I hope that in the next years this will happen. There are some changes in the leadership in some important countries. Let's hope that this will catalyze some more active action towards this problem.
I love the diplomacy of saying there have been some changes in some important countries. Yes, that's true. At least we think it's true. But let's not go there. Let's turn to Elizabeth right now, because Elizabeth, I'm very mindful that it's easy to talk about public health policy in terms of leaders in public health and senior doctors and academic researchers, but you are an international representative of the nursing profession. And I just wonder, particularly when we're talking about practically what can be done on the ground in countries where healthcare infrastructure is challenged by resourcing, just how important the role of nurses can be in this discussion.
Well, I think, thank you for that question, Stephen. I think it's a really critical role that nurses play. You'll probably find that it's the nurses and the midwives that are in these remote settings, in these remote islands, and they're probably the only ones on those, providing healthcare services. Their roles I think are really critical in terms of actually keeping people away from hospitals. I think that's for climate change. If we can prepare our communities, work with the communities, and utilize actually the individuals in the communities through some community public education around emergency preparedness. I think you're going to have, in these limited resource settings, you're going to have to call upon the people that are in the community, and they're not necessarily healthcare workers. So I think it's really important the role nurses and midwives play in these communities by understanding who's in the community, who are leaders in the community, whether they are in an ungovernment organization, in the civil society, or actually in other health sectors, whether they're in education or whether they're in the Ministry of Infrastructure. It's really trying to harness the available resources on the ground. I think nurses and midwives are in that critical position to actually make some of these critical decisions to enable a population-wide support during the event of a crisis, or actually before the crisis, and in the event of the crisis, and also post-recovery. So I think these are really key elements that I found in small island development states, that nursing personnel are very critical. And I think the COVID-19 situation is highlighted for us as well as to the role that nurses and midwives are playing, and how important it is that we take care of them. Because I think if you're not going to take care and make sure that they've got working conditions, you know, that you're going to further compromise the necessary providers for the services you require.
I think that message about the absolute centrality of nurses and nursing is well taken by all of us, Elizabeth. Thank you very much for that. Christiana, I want to bring you back in. And it's a broad question again, and it keeps recurring, this question of how climate change impacts on health are going to differentiate. Some people on our planet are clearly more vulnerable than others. And the questioner says, clearly, you know, this is going to affect women and children, the elderly, those with pre-existing conditions, people in low resource settings, indigenous communities in a disproportionate manner. In fact, you could put almost anybody on that list except healthy men in high resource settings, which I guess is true. So the questioner says, surely there needs to be a better way to prioritize the populations that are going to bear the brunt of climate change. But do you, Christiana, have any idea how one would go about that? Christiana, you're on mute. Can you hear me? Because are they?
Sorry, I thought the system would unmute me. Sorry. Yes, it's absolutely true that climate change is an accelerator of so many impacts, that forest fire, floods, droughts, natural conditions that have existed for many years, but that now are being accelerated by climate change. At the same time, climate change is a deepener of inequality. So inequality, all of that you have mentioned, plus much more, by the way. We have been irresponsibly tolerating that inequality for decades, and climate change deepens that inequality. That is the crux of the injustice that is embedded in unaddressed and unmitigated climate change. That is exactly the reason why we cannot tolerate inaction on climate change. Because yes, we can use very important funds, such as from the Carter Fund, to help some vulnerable populations around the world, but there is never going to be enough support to support everyone who is vulnerable. The only way to get us out is to address climate in a timely fashion. The way to think about it is, the only way to get us out of COVID-19 is to have a vaccine for everyone on the planet, not only for, what did you call it? White men sitting in privileged areas or whatever, you know, the way that we would have gone at this several decades ago. That just doesn't help. If you just vaccinate white men sitting in privileged areas, that doesn't help the world, because eventually they will get the virus. So we have to understand that we are sitting in a boat. And it is, if there's a hole in the boat, and there's a gaping hole in the boat right now, it is not only those that are sitting close to that hole in the boat that are going to go under. If there's a gaping hole, and there is, it's all of us that go under. That is the mentality that we have to be able to understand, This is about everyone. It's not about only the privileged or only the vulnerable. The fact is that climate change does not stop at my gate and ask me, or, the forest fires do not stop at the gate to say, excuse me, what political affiliation do you have? Or what does your bank account look like? It doesn't. We are all in this together, and we have to make sure that, as the UN has been saying for years, that we leave no one behind. It's absolutely the mentality. And this is about, Stephen, this is about changing our mindset, right? This is about changing our mindset and understanding that we are all humans on one planet, and we have to be able to allow everyone to thrive, because we are as weak as the weakest link. If there's one person who's not having the well-being that they deserve as a human, that affects all of us. And that is a dark mark on all of us. So it is about understanding we are all on this boat together, and we have to be able to keep everyone afloat.
Yes. Amen.
Stirring, very stirring words, Christiana. David's giving you 2 thumbs up, and I'm now thinking to myself, there's no way that anybody during all of those complex negotiations about getting to the Paris Agreement was ever going to disagree with you, because you speak with such persuasive passion. How could anybody possibly disagree? Thank you for that. We're almost out of time, but Ali, I'm aware I haven't spoken to you for a little while, and I just want to get your thoughts on one question that's just come in. And it's an interesting one. It's a practical one. It's less about big vision. It's more about practicality. And as you invest money in health projects around the world in developing countries, I'd like your thoughts on it. The questioner says, it's interesting to note that in countries like the UK, there is now an official target to turn the National Health Service, our national health system, into a net zero, net carbon greenhouse gas emissions system by 2040. Now, is that kind of ambitious target realistic for developing countries as well as the rich world developed countries? What do you think?
Let me start with something. As a fund, we're very quite new. We're just 6 years in operation. We have such inspired management and board of directors. Despite that, when we started in the operation, we were in the late of MDG, the millennium. Then we updated the strategy to reflect the SDGs. As we can see, we are focusing on 3 sectors, mainly education. 50% of our fund goes to education, health, 35%, and 15% to the economic empowerment. So we are as we are moving now, a new multi-sectoral approach that we are using is the environment, the climate change. So we have taken serious measurement by the leadership and the board of directors to have the climate change and health in any program that we're considering. So we are not very sophisticated like UK, but we are working hard with the team to achieve the SDGs by 2030, and we are putting on top of our agenda health and the climate change on that regard. So setting such objective goals would be very hard to announce it now, but we are working towards that.
Ali, thank you very much indeed. We're almost out of time. I want to give the last word from the panel to David, and then I'll try to sum things up. But David, you introduced your report, your forum report, at the beginning of this session. You've heard some fascinating words from our wonderful panel. I just would put it to you that in the context of a world wrestling with the COVID-19 pandemic, which you, of course, personally are grappling with at a very high level yourself, do you think there, in a way, is a danger that, as so often in healthcare, it's a question of priorities? It's almost like a triage metaphor. You have to deal with what's in front of you and make some very difficult decisions. And is the danger that always public health and climate change, because it's so long-term, it's so strategic, and it isn't necessarily for a lot of people about what is happening in our healthcare systems today, although we've heard many times today that actually it can be that, but often it isn't. Is that perhaps a reason why still today climate change isn't front and center of debates about public health in the way that it should be?
Thank you, Stephen. Thanks for your masterful moderation of this panel. Just like to really emphasize some of the points that colleagues have said in a very few words. Climate change is happening now. It's affecting people's lives all over the world. Hundreds of millions of people are being affected by it. It is unjust. It's poorer people who are most affected. And perhaps more than ever, it's time for health professionals to just do the thing, get involved. Every health organization should come together at top leadership level saying, what are we going to do about this? Every health professional should be thinking of ways in which they can talk, act, and lead on climate change. They should be doing something different each month. They should be sharing what they're doing with the website and the email address that's been set up by this forum. In 2 years' time, we want to come back and look at it again. We've done this report because we believe there is an extraordinary role that health professionals can play. We've seen what they're doing on COVID. We'd like to see them doing it on climate. And Stephen, I don't think people feel that climate has to take second position to infectious disease. I think people are realizing through COVID that the power of working together, particularly at the local level, is a power that we must build on and we must nurture and we must take it with us, because without that, we'll get not a good result. And with it, we can make a big difference.
Amen.
David, that's a great way, I think, to end your presentation. And I think everybody would like to thank you so much for chairing the forum and for presenting the report. And I know a lot of people will want to read it in greater detail after this WISH conference is over. So thank you so much for that. As a journalist, all I would like to say as a sort of my wrap on our discussion today is that what I love is the notion that healthcare leaders need to step up and can themselves be the change, and can also, perhaps more than ever before, utilize their voice to influence the wider public debate. Maybe sometimes healthcare leaders are a little loath to do that. Perhaps they worry about being too political or entering sensitive political territory. I think David's message is it's far too late to worry about the niceties of that. It is time for healthcare leaders at all levels, as Elizabeth pointed out, at all levels, to use your voices and be very clear about the degree to which this, just like COVID-19, is now, and it's urgent, and it needs to be at the top of the public debate. So that's my sort of takeaway from a fascinating debate. I'm looking at my screen. I want to thank all 6 of you so very much for being part of this. It's been my pleasure to moderate it, but it's been your thoughts that have made it so worthwhile. So thank you all very much. And I think I can now say that our climate change and health panel is now done. Thank you all very much indeed.
Thank you.
Thank you. Thank you, David. Bye-bye.
Stephen, thank you.
If you could all still hear me.